Why is it in this left AIC, right BC position that when the right scap is forward and the left scap is back, why is it that the right side has more expansion, the left side has more compression posteriorly when the trunk is technically rotated to the left? But then when you have trunk rotation, like let's say I did a left trunk rotation activity, I would then have the spine turning right, which would open up my left and close my right, which is a totally fair question. The answer to that is it's like the idea of the scaps in like the wides and narrows, for example. So with the wides, they're going to be pulled back, which is a result of their compensatory pattern. And then for the narrows, they're going to be more open. And that's a result of their compensatory pattern. And same thing for a left AIC, it is technically a compensatory pattern. So we're going to have a right scap that is forward, left scap that is back, which allows for the air to go in the right side more. But that's a bilateral symmetrical stance. If I were to just stand with a little bit of trunk rotation, it's not meaningful enough as if I did an actual reaching activity. You guys see the difference there between a real reaching activity and just like a bilateral symmetrical stance where it's very, very subtle? That's why there's a difference there. So in a left AIC pattern, the right scap and the overall trunk rotation is a resultant outcome of a compensation. Whereas under normal circumstances, if I did a reaching activity, I should have more expansion posteriorly on the side where the musculature isn't concentric. In this case, it would be the left side. I hope that answers your guys' questions. If you have anything else on that, let me know. Okay, so now I'll just open it up for anything general. Any questions before we get into the study guide?
Hey Connor, one of the things you were saying around the right diaphragm breathes air into the left lung.
Yes.
Can you explain that? Because I can't envisage that.
Yeah. So when we breathe in diaphragm, like you can think of the diaphragm as one thing or just separate halves. But if you look at any depiction of a diaphragm, then you're going to see like an asymmetry, right? So really, I look at it as two halves. So the right one is sitting on top of that liver. So it can't descend and stay descended as much as the left one, where there's just less stuff in the way. The left one can descend and stay descended. So it can't really descend further relative to the right. So the air from the right is going to ultimately fill up the right, yes. But then the air from the right is also going to go into the left because it's the path of least resistance. So it's like, yes, the diaphragm is one muscle and it's working together, but the right side is just working more. And the right side's air is going to fill up the left lung more because of this position. But it's not like, you know, the right side only fills up the right side and the left side only fills up the left side. It's like one muscle. I hope that makes sense.
Hey, Connor. So I had a question about this is actually a case study of mine. I have a client who I'm currently working with who actually, it's good timing, was talking to me about this issue that he's having yesterday. And I was wondering if I could maybe pull up like a picture of him.
Yeah.
That we can walk through maybe what's going on here.
I'm going to make you the host and then you can share your screen.
Oh, wow.
A lot of power.
Yeah, a lot of influence. All right. So can you see this?
Yeah.
Okay, so this is not mirrored. So so this is his actual left arm. This is his actual right arm. And I know it's a little bit of a weird angle to see him at because it's like a little bit lower probably than we would want it. But to me, it looks like his right shoulder is a little higher here.
Mm-hmm.
And so I know we talked a little bit about that in lecture about how, you know, obviously everyone is going to start in this left AIC, but then resultant compensations can lead to this sort of thing. And what he's been experiencing is this just like on and off pain for years. He said it's really dull. It gets worse with specific things, but it's really in this like, he said he's feeling it in this right upper trap area, like maybe levator scap, upper trap.
Mm-hmm.
And he said it's probably the worst when he does like a straight arm lat pull down at the bottom. So I was just kind of trying to work through that in my head, and I just ended up sort of confusing myself. And I was wondering sort of what your thoughts would be on that.
A straight arm lat pull down at the bottom. That's interesting. It's like a very specific.
Yeah.
Is there anything else, or is that the only context that he gave you?
He said it's not like a sharp pain really. It's more of a dull sensation consistently. And it's like it doesn't hurt him when he benches. His movement patterns aren't like wacky. It's not like he has like one arm up here or one arm up here. But a couple things that I noticed were one, I had him do this just a normal external rotation flexion test, and when he tried to keep his right arm straight on, what ended up happening was his whole trunk would rotate this way, just like sort of subconsciously. That wouldn't happen the same way when he used his left arm. But I think other than that, all he said was right neck rotation felt super uncomfortable.
Yeah. So the pain is like dull in his trap itself.
Yeah.
Yeah, I think a couple of things could be going on here. One is that, like, clearly the dude's right shoulder is higher than his left, but his left trap is still broad and wide. It actually looks like it might be more wide than his right one. So usually that's what you see in the left AIC pattern. So he's obviously just cranked and turned. So he either has, where's my pelvic bone? He either has a left lateral orientation of his pelvis, which I might imagine be what I might imagine is a case here, but I don't know unless we assess him, because then in that case, what ends up happening is the left gets pulled, the left gets pulled down and the right gets pulled up as this comes together, the ab wall and the oblique attachment up on the ribs. So that could be what's going on, but he also could have a superior T4 syndrome in PRI. And are you familiar with what that is, Ben?
I'm not.
Okay. So in PRI, and I don't really get into this because I don't know. I don't think it's just another thing for you guys to think about. And ultimately we can just get rid of it by, understanding the limitations. But what ends up happening is the rib cage above T4 counter rotates back to the right. So what that does is it brings the left shoulder lower and right one higher. So that's an attempt of the right neck, like the scalenes and other neck muscles that attach on the rib cage to elevate the rib cage to bring air in. So when that happens, you could see that this would elevate the right side, and that would probably limit rotation of the neck to the right. So I would be curious what his measurements are for anterior expansion on the right side, like his internal rotation, like his adduction. Find what those are. And if those are really, really bad, I would restore those first. And I might honestly get him in like a right short lever side plank and like get him some right abs and then allow that expansion to happen. So if you got him on like a right short lever side plank, then gravity would act down and everything would be pushing down on his right side to expand it. So I would say that's probably a good first step, assuming he can get into that without any issues in his shoulder or trap.
Okay. Yeah, that makes perfect sense. Thank you.
Cool. Anyone?
I have a question.
Okay, sounds good. What's up, Amy?
Okay, so next week I'll begin working with a client. She's a narrow ISA, and when she first reached out to me, she said that she was laughing, and then she felt pain in her rib cage on the right side. I'm really trying to understand whether that's like a result of having too much like compression in that right side of that rib cage, as well as her body just doesn't know how to manage pressure.
Where in the rib cage is it?
She kept on saying that it was up here, up on the side, not the back side, not the front side, but more upper, like this area here.
Yeah, I think that's, and again, I hate to make it dogmatic into like what we are as humans, but because this is usually a little bit more compressed, if you just got that person in, I don't know, just like any sort of position where they're just, sometimes I'll just get people who are really stuck in their right side. I'll just get them to like hang off of something and just do like something like this and just stretch all this crap out, and it really does help them sense expansion. So something very easy you can do if you feel like this is something that's not that big of a deal. You can just get them up against the wall, thumb down, take a step back, open up right here, and then just breathe into that lat, and everything here will help release. And that's a really good way to just quickly, nip something in the butt like that.
All right.
Give that a try. Thank you. Yeah. Also, Ben, if you wanted to post that person's assessment, I think that would be really, really cool. Just as like a case study for everyone to look at. I think that'd be sweet. Anyone else have a question?
Yeah, Connor.
Mm-hmm.
You can go ahead, man. I'll go after you.
There's just a quick question. You mentioned at the beginning of the presentation about the importance of triceps, but then you don't mention it again. So I was curious, where are we using the triceps, or how we engage triceps, or?
Yeah, let me pull up. We're going to get into that in the corrective exercise week, but I brought up the triceps for this reason. I'm going to share you guys the slides. The only other time I mention them is pretty far down the line. So I mentioned them here. So yeah, long head of the triceps, important if you had a weaning scap, right? You're going to get downward rotation with it to work with the lower trap as well. But then if you look at the right scapular orientation, because it's in more of a wing state, we would want that tricep to work in a downward rotation manner along with the low trap to help secure that scapula back on the rib cage. But that's only necessary once we can get anterior expansion. Because if we can't get anterior expansion, then that right shoulder is always being pulled forward, and there's no reason for us to even think about the tricep or low trap, because the breathing is always going to win. The skeletal position is always going to win. So if we can get this thing to expand, then we won't even need to think about that as much down the line, because they're just going to be breathing normal. And their position will be normal. Does that answer your question?
Yeah, but I mean, as you said, it's like the hamstrings of the rib cage.
Oh yeah. Mm-hmm.
So I was thinking, like, maybe as the hamstring, we use them to posteriorly tilt the pelvis. Maybe we are using the triceps somehow to do the same when someone is extended or compressed.
Yeah, you can think of here. You can think of like the scap is nutating if you really want to go down that rabbit hole, if when it's forward and winged out like that. So you would want to use that hamstring or that tricep to pull it back and down, because when that muscle contracts, as it attaches on that lateral border, it's going to go from here back to there. It's going to posteriorly tip a little bit as well. So that's why we think of it as the hamstrings. You can draw a lot of parallels. I've actually thought about doing that in this course, but I think it's just ultimately going to cause more confusion. So I just tried to stay away from that. But do you see how that would work when that long head?
Mm-hmm.
Yeah. So that's how you can think of it, like a hamstring.
Okay. And just one quick one. So if what we want in a left AIC is expansion on the left side, on the posterior aspect of the rib cage, why in an alternate crossover 90-90 we are reaching 90 degrees where we could actually do a lower reach?
Oh, you're saying on the single leg 90-90 hip lift area?
Yes.
Yeah. So the reason why we're getting that is for right trunk rotation. So if you reach your left hand, you are going to rotate your trunk to the right. So that is working on the trunk rotation aspect of things and using the oblique as a means to do that trunk rotation, which will allow you to get your left hamstring with the right trunk rotation. That's really what it's for. It's really for oblique more than anything else. But I understand how you would, I see where you're going for. But you definitely could do a lower reach, and that's entirely up to you. You don't have to do it exactly as it's written in that exercise. You could do supinated low reach and it'd be totally fine.
Okay, cool. Thank you.
Connor?
What's up?
Hey, so we talked about it in the last call on Monday. Someone had mentioned that they come from an FRC background. That's me as well. And I was just wondering, I agree totally with the thing you said about the centration. And I really noticed that that's kind of like a missing element in the FRC practice. But the one thing I have a question about is this idea of like adaptation takes time, and adaptation there's no real like quick before and after tricks. Like FRC really isn't, or Dre I should say, isn't cool with those, I should say. Like he doesn't like when, like someone's like, oh, look at before, and then you do like a quick exercise and then they'll look after, because he's like, it's not telling me anything about long-term change. So I'm wondering, like, because I think I'm where I'm at right now, I really agree with that, with what he's saying. So I'm curious about like just an example. Like you just talked about doing that lat stretch to open up the right side. But from your lens, is that just opening up a potential space to do something else to provide adaptation, or is like, would that just, is that what you're giving to people, a couple seconds or 5 breaths, and you're noticing that that's actually causing a true structural change?
Well, to go back to why that guy doesn't like the before and after stuff, I would ask, how would you be able to tell that the long-term changes are being made? Like, what would his answer be, do you think?
Objective measurements.
Right.
Like,
so So what the before and afters we use in the assessments are objective measurements. So the reason why I think the before and afters, like quick 1-2, is really important is because it will tell you if what you're doing is going to work. So for example, if I gave someone, I measured their internal rotation, I gave them that lat release, and then their internal rotation dropped, then that is a strong indication that if they keep doing that and they do it over a period of time to allow for those adaptations to occur, then that's going to stick. But if I gave it to them and it didn't improve what they're looking for, then I'm probably wasting my time with that person, because why is it going to suddenly magically get better if I don't see improvements right then and there?
Okay, so it's kind of like a quick little glimpse into the future that you can have with your hour meeting with or whatever, how long it is. Okay, cool. So just to kind of add to that question, if like when you're giving, when you do something, like let's just use this lat stretch example, you do a lat stretch with someone and you're like, oh wow, your internal rotation improved by approximately 15 degrees. Are you going to continue to just do that, whatever the thing, like if it was a lat stretch, the lat stretch, or are you going to know that, okay, based on that finding, he could probably use maybe more expansion into the right rib cage, and then more length through here. So, and that's what you're programming, or would you be as simple as just programming a lat stretch before exercise?
No, I think along the lines of what you said the first time. So if I find that it does help them, then that would be part of, excuse me, I got some stuff in my throat this morning. That would be part of where I'm trying to target. So let's say right anterior expansion. Great. Okay, we're going to do that in exercise as well now. So for example, when they're doing like a cable row, I might have them pull, reach, and then inhale in this position right here, because their scap is pulled back. They're going to feel that expansion right here.
Okay.
And then exhale and come back. So I'm just going to be doing small things like that to help them drive that adaptation, and then everything should be good. But I then know the lat is a major player in that. So am I going to do a ton of pull-ups with that person afterwards? Probably not.
Okay, got it. Yes. Okay, cool. Thanks a lot.
Mm-hmm.
I got a quick question, Connor. So this might be jumping ahead a little bit, but do you see people, because I noticed with the PRI exercises, like on with Neil Hallinan and a lot of the other ones I see, it's always, right glute max, left adductor.
Mm-hmm.
It's different sides. And I know that's obviously for a reason, but do you see people like go too far and compensate, not like structurally, maybe they just like go over and they become like a right AIC or a left BC or something where they overdo the PRI? And do you ever do both sides? Like, I'm kind of curious how that works.
I've never seen someone go that far. I've heard a story once from someone who taught a PRI course, but I don't really know what that looks like at all. But there is a world in which there is technically a right AIC pattern. And I've been messing in my head with the idea of, do we really include this? But essentially, PRI refers to it as like you have a lot of rotational torques placed on your body. And you see this a lot in baseball players, and you see it a lot with people who have had significant right side injuries, is that they actually do start to represent more of a right AIC, so to speak. So what those people actually need to do is find a right side first. And if you don't find a right side first, then you're just going to be trying to layer a left side on a compensatory left side. And then it's all messed up. But that's also why, like, if you just follow, once you guys see the progression of things, Amy, alternate. If you just follow the progression of things, like clear the bilateral stuff first, just get it all out of the way, and see what's left over from that, then you're going to be able to fill in the gaps. And usually with a right AIC person, they're going to be in a position of like, there's so much torque going on. So we just got to unwind them bilaterally first. And then there will usually be a resounding, like, apparent left AIC pattern. Every time I've seen someone that's like, wow, you really present the exact opposite, I clear them bilaterally. And then they might have, some discrepancies left over. In that case, I might just give them a right side first and then go to the left. But usually they're just unwound at that point.
Okay, cool. And off of what Tyler was saying with, so you do, like, let's say you check the person, they need more expansion, they need more internal rotation or whatever, and you do the intervention and it improves in that session. Is that something like, how often do you check that afterwards to make sure you're making progress and it's like sticking? Because like we want it to stick outside of the session and with the training and everything, right? Not just temporarily.
For sure. And since I've been doing stuff online, I would do this similarly in person if I did have like an in-person business and COVID wasn't a thing. What I would be doing is every single week, I would measure them. And what it is right now is I'll have my initial assessment with someone, and then I'll measure them, explain their problem, give them some things to think about, give them a program. Every single week we have a check-in. So in that half an hour, I will assess them, hear anything they have in terms of feedback, and then I'll make adjustments. So I think once a week is generally a pretty good baseline. You could do more often than that, but honestly, when I've tried to do more often than that, things come and go because it's a non-linear process. So someone might measure themselves every single day and they'll be like, wow, I've got, I'm actually worse today than I was yesterday. But then all of a sudden the next day they're like 15 degrees better. So it's a non-linear process, and lifestyle factors, stress affects it, all those things. So I find like once a week is a good measuring stick to see where things are at. And honestly, sometimes even that can be a little bit too frequent depending how consistent this person is. But I think you can't really go wrong with once a week.
You just make sure they're getting the measures better, and once they've got them where you want, they're just kind of keeping them there, right? I assume.
Yes, because at that point because you'll be doing other things, right?
Mm-hmm.
So if you're doing lots of alternating reciprocal activity and you've opened up that space, then they're going to keep it if they keep going with those activities.
All right, cool. Thanks.
Mm-hmm. Of course. Any other questions before we get into the study guide?
Honor? Yes, is there any difference when we are pulling or pushing in the degrees we are doing it, or is the same?
It's different, but it's for the purposes of what you guys are thinking about right now. I don't want you to think it's that different, because ultimately think about it like, let's say I'm doing a row at a 45-degree reach, right? I'm going to pull one back. I'm going to reach the other arm if I'm doing an alternating activity. So at that instance right there, I've got a lot of compression happening on my right posterior. My right anterior is going to be a little bit more open. Now, if I'm going to do a press in that position, let's say I'm pressing with my right hand, my left is coming back. This is where it can get tricky, because the pec engagement is going to prevent expansion happening from going anteriorly. And if you're using any kind of load, that pec is going to be active. So you're pressing here. Now you got compression here, but that could be a good thing if you're trying to target some posterior expansion. That can actually be quite beneficial. So you got to think about that, and you got to think about how much trunk rotation do you actually want as well. So if I really rotated my trunk a lot and I had my pec active, so I'm reaching with my right, got some left trunk rotation, but now my spine is actually turned to the right. So if you really wanted to target that right posterior expansion, this is getting in the weeds a little bit, you probably wouldn't want them to rotate that trunk a ton.
But that's still a 90 degree reach. And that,
Let's pretend I'm doing a low reach. I'm just trying
okay,
to
sorry, yeah.
Yeah, I'm just trying to stay like
Yeah.
very, so right there, like a 45-degree reach.
Uh-huh.
Then you would be able to get some posterior expansion as well. So they are different, but also you could also think of it as like more of a rehabilitative sense. So if you have someone that's just trying to get into like the very first steps, then I might do like a very low, like, 20-pound cable reach, see if they can keep that pec off, and just use that as a means to get them engaged in something that's not on the ground and boring.
Okay.
Hopefully does that answer your question, Earl?
Yeah, I mean, as I understood, for the purpose of expanding or compressing, it doesn't make a big difference when choosing exercises, like
Yeah.
pushing or pulling. Thinking about the strength. So
Think about the angle of the reach. And then, because for example, on the road too, when you're being pulled back with the weight, then that's going to also change very similarly as if you were pressing that weight. The only difference between the press and the pull really is what muscle is concentric on the obviously concentric action. So here I'm going to get more concentric orientation when I'm back here. On the press, it's going to be the opposite. When I do this, I'm going to have more concentric orientation here.
Okay.
But that's a good question. I'm glad you brought that up.
And I have one last one. I was confused when you mentioned the pec minor doing depression and posterior tipping, but I don't see how the pec minor is doing posterior tipping. Like I visualize doing like the opposite, like anterior tipping.
Yeah. Here, let me pull up the slides. Oops. All right. Did I have that in? Where's posterior tipping?
Yeah.
Yeah, that's interesting. That might have been in. That might have. Oh, actually, yeah. See, I'm stupid. So here we go. So do you see how when that pec would pull on this attachment right here, it would do this?
Yeah.
I think that's what it's referring to. Yeah. Now that I'm actually visualizing it, that makes a lot more sense. But you would think about it like it would be pulling it further forward, right? But it's the attachment. That's what always confuses me too, is I have to remember that the pec minor is actually a downward rotator because of the anterior attachment. You think it would pull it up, right? Not necessarily.
But it depresses also. So it's what?
Because downward rotation is usually paired with that depressing.
Thank you.
Of course.
Connor, in your powerlifters that you work with outside of the main competition movements and their close variants, would you ever really see a reason to do something bilateral and in an accessory as opposed to alternating? Because I don't.
That's a really good question. I think because I work with powerlifters in a rehabilitative sense a lot of the times, I'm very, very weary of ever giving them like a bilateral symmetrical stance activity as a secondary lift. But I see the value in it in their regular programming. I totally get it. In fact, it's probably beneficial for them to do that because it's more specific. I think once you get to the tertiary block, you can start to think about those things a little bit more. And that's what I tell my powerlifters. The goal is to get you to do a full powerlifting program and keep doing it without getting back to where you were in the first place. So you're always going to have this alternating activity. You're always going to have it because if you don't, then you're just going to end up like a lot of other powerlifters. So I like to say, have your tertiary block be entirely made up of the unilateral alternating action. Secondary block, if you want to do like a close grip bench or something like that, something that's, going to be compressive, but also help you achieve your goals, then yeah, I think that's okay. But when I'm working with them, I tell them to take that stuff out because they're not ready for it yet.
Gotcha. This is also a little bit of an aside, but the last like 24 hours, I saw two different powerlifters that I know like pretty much tear their left adductor. And I was wondering if that was something common that you see, because I hear a lot, and I know someone personally who hurt their left adductor like a week or two ago. And I was wondering if it's just because of that left AIC and maybe it's got a little bit more length and you're putting a lot of stress on that length.
Yeah. Do you know the context of how those injuries happened?
Yeah, two of them were squatting, and I definitely noticed more of an anterior orientation in the pelvis in both of those cases. And then one of them was just at the bottom of a sumo deadlift.
Yeah, so that would make a lot of sense, right? So the adductors, they do attach, some of them attach here, so that helps pull the pelvis forward as well. So the left one is a little bit more on an eccentric orientation than the right because of this pattern we're in here. So if you're in a sumo position, you're putting more eccentric stress with load on a muscle that's already eccentrically oriented, and also concentrically oriented depending on where, because like muscles can be short and tight at different places within the entire length of the muscle. So for example, there's actually a study done on this. So for example, the hamstrings can have long proximal fibers but short distal fibers, which flex the knee more so than the hip extensor muscles. So there could be something going on where you have more of a concentrically oriented proximal adductor and more of a eccentric distal. That could just be the case. But anyway, you're putting a lot of eccentric stress on a muscle that's already eccentrically oriented. I also see a lot of right adductor strains for a very similar reason, because that muscle is already very tight. But if you go and put eccentric stress on that muscle, then it could tear or it can strain because it's not able to stretch as effectively because of that pattern. So I think that would make a lot of sense then. I think that would make a lot of sense given the context of that pattern.
Gotcha. Yeah. Thank you.
Anything else?
Hey, Connor.
Hey.
Hold on. I'll start my video so I'm not just like a blank screen. So I have a question about Pat's post on it's like the single leg RDL with the wall reference.
Oh, Pat Davidson.
Yeah.
Oh, okay.
So I don't know if you saw it, but he says like, if your nose isn't over the front big toe, it's not right. And he has all these descriptors. So a couple of them that I had questions about was why he says, if the back knee isn't coming in towards the front leg, it's not right. And the other ones I get, but I just had questions about that specific cue, like why you would want the back leg to come towards your front knee.
Back leg to come towards your front knee. Yeah. So I think I see. Is this a recent post he's made on any social media platform?
It was on Instagram. It was like 5 days ago.
So is this it right here? No.
It's this one where he's shirtless and sweating like crazy.
Yeah. Okay. Here, I'll pull it up so everyone can see. So here's sweaty, shirtless Pat Davidson. And so he's saying, if your nose isn't over the front big toe, it's not right. If your front hand doesn't have the middle knuckle, blah, 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 it's not right. Okay. I think what he's saying here in terms of the back knee coming towards the front knee is the hip shift. And that's actually how I cue a hip shift. Everyone, let's do this. Everyone get up and this is my favorite hip shift cue. Visualize this a little bit. So you can place one foot in front of the other, like you can place your back foot on a wall if possible. Bend both knees. Tuck your hips. Now think about pulling your front knee back and pushing your back knee forward. See how that works? That's a hip shift. Pull your front knee back and push your back knee forward. Most people pick that up pretty straight away. Also, just watching people do that, that's the hip shift right there. And that's a much easier way I've found than just trying. Honestly, I don't even remember what it's like to cue a hip shift any other way, just because this is a lot easier. Another really good cue for cueing a hip shift is imagine you're trying to pull your front leg out of wet cement. So what that would do, imagine that you're in cement and you're here, you can't get out of it. What would you do? You pull, but you couldn't get your leg out of that cement. So you would hip shift. Good little cue for you guys if you ever want it. But I think that's what he's going for there, Tyler. And the nose over the big toe thing. So I think Pat has those. he's got like something called a checklist, or someone can correct me in the terminology, but he's got something like, these are the landmarks for single leg stance, like frontal plane training. And I believe nose over the big toe is one of those cues, because if you are going to hip shift, and you are, man, my camera's just not big enough. You are going to hip shift, and you do want to center your everything together down a line, then you do want your nose over your big toe technically, because then the hip is going outside of the femur and you're in more single leg stance for training. And this is that AFIR that I was referring to in week 2. Does that answer your guys' question? Does that make sense?
Yeah, that definitely makes sense. But when he's talked about this in the past, he kind of talks about like purposefully internally rotating the back hip so that the knee goes toward midline, not necessarily that hip shift like AFIR motion, but more so, to me, it seems like he's trying to cue like adduction and internal rotation of the back leg, which is kind of confusing to me.
I see. So it's not a hip shift. Okay. So
Yes.
I'm not sure what he's going for there, because I haven't ever used that cue before, but you're saying he's trying to do this sort of act.
Yeah, I think that's where he's getting at with that particular cue. Because he's had videos in the past couple of weeks where he's told the person doing the exercise, like, drive your back knee in, or like he had his hand on their back knee, and like telling them to drive into IR and adduction.
Yeah, Connor.
Go ahead.
I know Pat personally, and funny because I was like the demo on the power hour for this. I was actually there in person.
Okay.
So he was like and all that shit, and his logic for adducting and IRing the back leg is because he's trying to get more compression on your right side, which is also why you're pronating the right hand. Let's say if like my left leg is forward, and he's cueing you to pull your left knee and push your left hip back to expand the left side. So it's like everything globally on the right side is trying to compress, extend, adduct, internally rotate, and then everything on the left side is trying to expand because you're shifting into that side.
So in this example, he's on his right leg.
Yeah, so the left side here would be the compressive side, and you see that if you look at his right hand, he's actually supinating that hand to aid and externally rotate that right shoulder to expand the whole right side of his body.
That makes more sense. I see. Okay. Thank you for that. Does anyone have a question for Ben regarding that?
That's interesting, because that makes me think of mid stance mechanics, and he's trying to drive mid stance mechanics on his back foot, even though it looks like it would be more late stance. So that's why this exercise in particular, I get confused with like what each leg is doing, because it doesn't look like what he's trying to get at is happening as he's doing this motion.
So his right leg is forward here. So you guys know the idea of how a hip shift is ER, technically, when you're at the top here. So his right leg is forward, so he is going into ER on that right side when he's at the top, at least. So I think that aids in the sort of like, correct me if I'm wrong, Ben, but that's aiding in his ability to drive those expansion mechanics on the right side in this instance, and compression on the left.
Exactly.
Okay, that was good. Anything else?
I have one question. Sorry, my camera won't work, so I just have to be a weird blank square talking to you all. And this question may actually have already been answered. It might be similar to Raul's question. So if it is, just let me know and I can watch the recording. But it's just with regard to some of the reaches in terms of is it the, how do I explain this clearly? Is it the joint position or is it the muscular mechanics? So say if you're going for like a reach above 120, if you were to like passively say put your hand on a barbell or a wall and sort of passively leave your arm at 120 and get somebody to do like whatever, like a half squat or a plank variation or whatever it is, but they're not like having to actively bring their arm to that range. Like, is it more the joint position that's driving upper expansion, or is it more the muscular action? Because there's quite a lot in the notes just about like what's contracting, what's lengthening, and what's happening in a muscular sense. But I'm just wondering how much of it is sort of joint position in any, you know, regardless of what's happening with the muscles, and how much of it is actually what you're kind of working in a sense to kind of compress and expand different areas.
It is the joint position. And that is, the muscular orientation is going to be secondary to that, just like with anything. And that's one of the big fundamental principles I think is important to appreciate. So if you did do, let's say, totally limp 120-degree reach, you're still in scapular upward rotation. You're still doing all these other things that are respective to the Lamarck model. So you are going to get the expansion as you would normally in a 120-degree range. I just would imagine it wouldn't be as specific as if you were to do it in more of a conscious reaching way. So the skeletal position is going to ultimately dictate what muscular orientation is there, and then air is going to go into the eccentric areas. But since you're doing this, you're still placing some muscles in a passive concentric state and others in a passive eccentric state. So you are going to then still drive air into those eccentric areas because of the skeletal position.
And just for like, say for somebody like I seem to work with loads of super compressed narrows at the top now that I know what they are, but it's just like, would it be worth, like for some of those people who are super pec dominant, upper trap dominant, would it be worth starting with some of the reaches in a more passive sense? Because it's almost the only way I can get some of them into that overhead orientation without actually using all of those kind of like upper neck muscles. So like, would you say that it'd be worth getting them doing some almost kind of more breathing drills with their arms just in a relaxed state overhead, and then try and drive more active reaching?
Absolutely. Yeah. And I think what I would think about before that is gravity. So I would think about, where am I, just because then you can passively get gravity to do its job and you don't really have to cue anything. So if you can get someone in a quadruped position and keep their, keeping their pecs off is great. Or you can do some sort of, I don't know, like child's pose where you're just on the ground and your knees are by your elbows are by your knees. And you can just hang out there because gravity is going to get that anterior expansion more so than anything else. And I think we often underestimate the influence gravity can have. And so I would think about that. But yes, the passive reach thing to keep the pecs off and the traps off could be awesome. So you can maybe combine the two in some way.
Yeah, great. Thanks, Emil.
Anything else? If not, I'm going to pull up the study guide. All right, I'm going to do that real quick. Did you guys, how has the small group meetings been with the study guide? I hope they haven't been, the balance I'm trying to find is not too easy, not too hard, open-ended questions that can spark some discussion most times. That helps you guys think a little bit. So hopefully that's been the case. With that being said, let's go over this one right here. All right, first question. Where would air expand the rib cage if you reached at 45 degrees with left trunk rotation and a supinated forearm? Where is air going in that position? I'm going to leave that open-ended. So we've been talking a lot about this today. So I'll give you guys this. If you supinate the forearm, you're going to get more posterior expansion. So where is air going to be driven the most posteriorly?
Right side.
Right.
And where on the right side?
Upper.
Yes. And?
Lower.
Right upper posterior.
Upper and lower. Yeah.
Okay.
So you do get lower, you also get upper. And the little trick to use is if you have someone that needs upper expansion and they can't get their arms past 120 degrees, which you see all the time, just reach low. And then you're going to accomplish a very similar thing, and maybe just invert them, and then you'll get even more. So if you can get someone, and this is something I've been playing around with some people, and I'm going on a tangent, but sorry, something that I've really had some good results with, and this is the stupidest looking position in the entire world, but it's so effective. It's get a couch cushion, throw it on the ground, and then go here and here. Looks ridiculous, gets amazing results. Use at your own risk. So that's one way you could get a ton of upper expansion. It works really well. So yeah, you guys are right. You answered the question. Nice job. So you are working with a narrow ISA and a left AIC pattern who has an anteriorly restricted rib cage at both T2 and T2 through 4 and T5 through 7. Provide 2 exercises to help restore a more neutral pelvis and rib cage. Narrow left AIC.
All fours and a rock back stretch.
So yes, I would say the all fours position is a fantastic place to go because you're going to be getting gravity. So that would help get them a more neutral rib cage. How would you go about the pelvis?
What about with just some basic pelvic tilts with a couple inhales and exhales at the end of each rep?
You could do that for sure. I think doing that within the all fours position would be good, but this person's narrow. So they're probably like, let's assume they don't have any additional compensations. We've got them back to just a normal human being that's here. What's one position we could give them that would help even out this asymmetrical pelvis?
You could elevate their left knees. You could put like a cushion underneath the left side and maybe get them to squeeze something in between the knees to get some adductors and a bit of like almost a fake hip shift on all fours.
I like that. That's really good, Ken. Yeah, you can do that for sure. You could also just, I mean, there's a lot. I don't want to give you guys all the answers, but yeah, you could do things like that for sure. That's a PRI exercise where they just do that, that knee elevation, and it does work quite well. What about, let's test a little bit. What about a weight room exercise? What about a split squat or like a deadlift variation? What might be good for this person?
Could you also do like a split stance, like a split squat position with like the hip shift that you guys were talking about earlier in Pat's example?
Yeah, you could for sure do that. And it would be more of a hinge, right?
Mm-hmm.
So then you would get more of what a narrow needs, which is more of an IR bias. So that would be a great thing to do. You nailed that. I think that's a perfectly acceptable answer. Okay. What might you see if you visually analyze the gait? Oh, sorry. Go ahead. Did someone else have a question?
Yeah, man, my apologies. I unmuted the mic because I was going to ask you to, if you could make the screen bigger, and then my dad called somebody in the background. So that was my dad. Apologies.
Is that better?
Yeah.
Perfect. What might you see if you visually analyze the gait pattern of a right BC, left AIC pattern? That's a tricky one. And I'll be honest with you guys, I'm no master at gait analysis. It's really, really hard. And there's a lot of things that go into it. And honestly, if I were to make gait visualization, gait mechanic analysis part of this course, it would probably take like 2 or 3 weeks, which, I don't think it's entirely necessary. I think it's very beneficial to look at someone's gait, but ultimately the objective measurements within, the assessments that we're going to talk about next week are going to be really, really important. So what might you see though? Like what might you expect if you see someone in this normal human orientation?
Less arm swing on the right side, maybe.
Less arm swing on the right side. In what sense?
I'm trying to think through here. They wouldn't be able to go as far back, right? rotating backwards, like to the right.
Yeah, you won't see as much of that. You won't see as much of left trunk rotation. So when they're taking a step with their, so when they're doing this, you might not see as much rotation happening this way. But when they go here, you might see more because of that rotation bias. That's a really good one. That's something I look out for, actually.
Be the same on the hips as well, just in the opposite direction. I know you can't see it as well, but hip rotation.
Yeah, inability to really like center over that that right side or the left side. Yeah.
Okay.
Something else you might see, I don't expect you guys to know this, is if you see a hip hike in gait, like if you see something like this, or if you see something like this, this is usually an attempt to find internal rotation because they can't do this. So they're trying to fake it and do that. So if you see someone's hips rise up, that is them trying to find internal rotation on that side most times, which would also help explain some of these pelvic orientations that we've been talking about. And we'll get into more detail later, but like an oblique orientation of the pelvis, maybe they're trying to find right IR, which they should have, but they don't. What else might you see? Like not with any of that extra stuff in there. What might you see in just this normal pattern?
Would you see that they kind of almost like they slightly like fall into their left side, as in like they're not getting good heel strikes, so they're kind of landing on their forefoot and not getting properly into stance on the left. So you're not getting that sort of left hip outside the femur, and it's like you're almost just slapping your. This is me because I know I do this, so it's like you might see that if you're watching.
100% yes. You see more of a forefoot strike on the left, and you see sort of like that slappy action. For sure, you see that. And I think as a consequence of that, you see people spend more time on their right side walking than their left. So that's a really good anecdote right there. Anything else? Those are the big ones, honestly. But yeah, hopefully that gets your brain churning a little bit. If a wide ISA client has 100 degrees of shoulder flexion, but still demands he has some sort of overhead presses in his program, what might be your plan of action? $100 isn't much. It's like that. So he's not going to be able to overhead press. He's not going to be able to barbell overhead press without doing this. He's not going to be able to do any sort of single arm pressing without doing this too.
So is that where you get them to do like a either a 90-90 or hook lying alternate dumbbell bench?
Yeah, that would be an option for sure, but that's not overhead pressing, and I really want to overhead press. I have to, or I'm going to go find someone who will let me.
Landmine?
Yeah, you could do a landmine, and that's technically overhead. So you could do, for example, you could do like even a standing landmine press is going to require less shoulder flexion because you can go from here to here. And I think most people would buy that as some sort of overhead movement. So you could do that for sure. Or you could just back away from it enough in a half kneeling position where they could do that. That is a adequate answer for sure. Another option would be a cable press of some sort.
Could you change the bench to an incline then?
For sure. Mm-hmm. Yeah. How do you think a narrow ISA could have compensated if they present to you with limited shoulder external rotation and flexion? What would have happened? Don't overthink this.
Would basically like an anterior pelvic tilt causing the lower posterior compression, taking away ER, and then shoulder flexion as well.
Yeah, pretty much. Yeah, you nailed it. Or they just, they feel like they're falling too far in one direction or the other. They might feel like they're falling too far forward because their anterior compression is pulling them that way. So they do that to upright themselves. It's just a battle of gravity. And yeah, Corey's exactly right. They might do it through their pelvis, rib cage, but ultimately they're just going to compress stuff on the back too.
Hey, Connor.
Yeah.
Okay, so just for an image, because I think everyone can kind of visualize this, whether it's yeah, it might be controversial, but like if you think of like lower cross syndrome, okay, or like layered syndrome or something, like when I look at that, I think of kind of like your typical yogi posture, you know, like you have like the like knees locked, hips forward, anterior pelvic tilt, hyperlordosis, kyphosis, and forward head posture. But when I look at that, or those, any of those, like lower cross or layered syndrome or sway back, I think they call it. It's like, to me, that looks like it has it's some of the stuff we're saying here, but it looks like they've already compensated out of that pattern due to the, like, for instance, like what we just talked about being a narrow, but then also having that anterior pelvic tilt. Like, because I feel like I don't see many narrows that prevent like the or present like a flat back and posterior pelvic tilt. It's always, well, I shouldn't say always, but more often than not, I notice it's paired with the like a hyperlordosis, knees locked out, anterior pelvic tilt. So I'm wondering if, like, do most people compensate out of the norm?
Oh yeah. I've never met one person that hasn't
Okay.
compensated to some degree. Yeah.
So that's why this like lower cross, upper cross, sway back thing got popular, because they're kind of compensations or deviations out of the normal asymmetrical pattern.
Exactly. Yeah. But
Okay.
and like, it's really important to know what that normal presentation should be, because you got to know where you want someone to end up. So, like, for example, when I get a wide, back to what a wide should be, they should have more IR than ER. Ideally, everything's looking good, but if I get them back there and they have more IR than ER, then it's like, okay, you know, this is not a terrible thing, because this is what you should have. Or narrow, same thing. This is what you should be. Left AIC, this is what you should be. So when you clear, almost every time when you clear someone bilaterally, they're going to have less right IR than left ER. And then these things sort of come up, and then you know you've got them where you want them.
So is the goal of like what makes you a better PRI coach someone who can kind of be able to visualize the layers and then peel them back one by one? Like, you know what I mean?
I think that's what gives people a lot of ability to, like, you know, zoom out a little bit.
Yeah.
And honestly, like, to give PRI credit, they do talk about this, but in my opinion, it's not, they don't present it. They don't make it very clear in the best way for new people. But they do, like, to their credit, they do say, like, clear someone bilaterally. Like, that's very, like, the PEC pattern, where they really talk about it like, you know, you're here, then here. You need to bring someone out of the PEC pattern before you go back into a left AIC. So I think they're on the money with it, but I think sometimes it's not as clear as it could be, in my opinion.
Okay, thanks.
Okay. What might be an ideal way to progress the 3 exercises in the slides from this week? I don't know if, just for the purposes of time, let's skip that one. It's not a massively important one, but this one I think is important. You have a wide ISA powerlifter who is dramatically limited in internal rotation bilaterally, around 50 degrees, but 70 is optimal. Bench pressing hurts his shoulders, but he needs to keep bench pressing because he has a meet in 2 weeks. Other than a neutral grip press, how would you modify the lift and program while minimally compromising his performance? So neutral grip press would obviously be an easy way to do this, but how else could you do it?
Could we make him press in a hook lying position?
You could do that, but I think that's still going to, you know, bias him towards his issues, because he doesn't have IR, and you're trying to drive IR on a system that's already very compressed. So that's going to be tricky, but you could do that and see if that makes a difference. But you see what I'm coming at, Raul? Just like,
yeah, of course. I mean, my point, if I have to do the lift, so he has to do bench press with a barbell, I don't see any other way to do it, instead of just giving other exercises that do pressing with, like you said, rotation or different angles. But if I have to modify the bench press, it's the only way I see, like, it could have some benefits or something like that.
Mm-hmm. This one was purposely a little bit tricky just to get your guys' brain churning. And I think the answer could be very, very simple, but I want to hear some other ideas before You guys might hate me for my answer.
What if you just changed whether you were like pressing like your grip through like the pinky and like the ring finger, or like the forefinger and the thumb, seeing how that would influence like the pain factor. I'm just throwing it there.
That's a great little cue, because that's going to bias them towards a little bit of supination. And I find in instances where they have a very, very minor little tweak, you cue them to think about pushing through there. It often helps, but I don't think it's like resolving the long-term issue. But you're right, Amy, that can be a very effective thing to think about while doing the lift.
What about like we talked about facilitating in the slides this week, like before, like give him something before his working set.
Yes.
Like whether, I don't know, just like I'm thinking like take a dowel, put it in front of you, do an isometric trying to rip the dowel apart, and then do an isometric trying to push the dowel together.
Yep. That's honestly like something along those lines, Tyler, is what I was looking for. So just before, because you would never do this with a power lifter normally, like, okay, I want you to do some posterior and anterior expansion drills before every set of bench press. No one will ever do that. So if you get them to, in this instance, because they have a meet in 2 weeks, they're going to have to, or else they're not going to be able to lift, or they're going to hurt themselves more when they go into that meet. So yeah, just being like, look, we're going to do this before and after every set because we don't have a choice and you still need to bench press. So that's one of those instances where it's like, you're going to do this drill and it's not going to be a forever thing, but I think they'll understand given the context. And that is an option you can do. Like, hopefully it opens your guys' mind to, you can do things like that for someone who needs it in the right context. I would just say don't do it all the time, because people don't usually like that. Good answer, Tyler. All right, guys. I've got another client, so I've got to run. But does anyone else have any final little questions before we wrap it up?
Quick question. So if you have the reaches in different angles, do you ever have someone like in shoulder extension below zero, you know, to drive air anteriorly or something like that?
Yes. So driving that shoulder extension is going to give you more manubrial expansion. So if you did put someone in a crab walk position, for example, which is a fantastic way of doing that, you're going to get air up top, which is really, really nice, because think about what you're doing with the scaps. You're also closing them off, which is going to push air forward. So really good position for your narrows.
Cool. Thanks.
All right, guys. Have a good rest of your day. I'll see you on Monday. Thank you for coming.
Thanks, Connor.